All right, let me quickly take you through the Omicron scare, the surge that's currently being witnessed in the country. We're looking at a total of over 700 cases in just the last 24 hours. Let me take you through the number of states or cities that have reported a high surge. Delhi being on top with 238 cases that's been reported, with 57 people who've been discharged after treatment. And then you have Maharashtra with 167 cases and 72 of them discharged. Gujarat next at 73 cases with 17 discharged. Kerala at 65 with 1 discharged in Kerala, and Telangana at 62, 10 of them discharged. Now, this is day 1 of fresh curbs that's kicked off in the national capital owing to the Omicron spread. Long queues were witnessed in many metro stations right outside crowded bus stops as well. The services are allowed now to operate only at 50% capacity, and therefore we see large crowds, long queues. Metro commuters faced difficulties as crowds piled up, flouting social distancing norms amid the Omicron scare. Crowds of devotees were also seen last night at the iconic Hanuman temple and other religious sites. Delhi Disaster Management Authority, meanwhile, is going to be meeting today to discuss current COVID situation. LG Anil Baijal, Chief Minister Arvind Kejriwal and senior officials along with experts will be attending this meet. Delhi's positivity rate has now risen by 0.89% and the Omicron count has touched to 238, out of which 57 people have recovered, according to the latest data from Health Ministry. Meanwhile, schools, colleges, cinema halls, gyms and spas are closed in the national capital until further notice. Shops of non-essential goods and services in markets and malls are also opened on an odd-even formula from 10 a.m. to 8 p.m. Restaurants are permitted 50% capacity from 8 a.m. to 10 p.m, while bars can operate with 50% capacity from 12 noon to 10 p.m.
अभी तक एक भी पेशेंट को ऑक्सीजन लगानी नहीं पड़ी है जो ओमिक्रॉन से पॉजिटिव रहे हैं और सभी लोग बिल्कुल ठीक होकर चले गए हैं। पॉजिटिविटी लगभग 1% के आसपास चल रही है। ऐसे हैं कि जो बाहर से लोग आए हैं वो थोड़े दिनों बाद पॉजिटिव हो रहे हैं, तो उनके कॉन्टैक्ट के लोग या उनके घर के लोग ज़्यादा हो रहे हैं। फिर भी सभी को सतर्क रहने की ज़रूरत है।
Under the GRAP 1 yellow alert guidelines, markets and malls are allowed to open stores on an odd even basis only. In addition, restaurants and pubs have been restricted to 50% of seating capacity, and restaurants will be closed at 8 p.m. while bars can remain open till 10 p.m. The night curfew has also been put in place in Connaught Place. Therefore, the effects of these guidelines is very visible. In restaurants and stores, the vaccination status of the staff and the notices saying that only 50% occupancy inside restaurants is allowed are back in place. Staff is also outside various stores with hand sanitizers being given to the shoppers who are coming here. The stores are opening only on an odd and even basis. However, the traders associations are not happy. They say that with New Year coming up, the shoppers would have come out in full force, and this kind of restrictions and shutdowns will affect their business negatively. However, with the government imposing these guidelines, the shoppers and the shopkeepers are following the guidelines and asking people to ensure that they are masked and ensure social distancing. In New Delhi with cameraman Nasir, this is Anisha Mathur for India Today.
Out of India, all governments have compensated their traders and everybody. Can the government tell what have they compensated to us? They are ready to take everything from us. Have they given any relief in the electricity? Have they given any relief in the house tax? They have not given any relief, and they are imposing more things. Government is not at all holding talks with us. They are just busy in their elections. Where is the protocol when they are doing an election rally? They want every protocol to be followed by the middle class trader. People are not shopping. If you see the walkers who are walking here, I mean, they are not carrying any of the shopping bags. They are just roaming around. No shopping is happening. And plus, the customers doesn't know what is the odd number shop, what is the even number shop. They're giving us calls. Is your shop open? Is this shop open? Even the association office is getting too many calls. What should we do? I mean, the other shop is closed for good. Should we open it or not? I mean, there's no clarity.
Was there 50% seating in the metro? No. What was going on? Full seating? No, it was full seating. It was full seating? Yes. Restriction नहीं था अभी अंदर? नहीं. बाहर लाइन्स थे मेट्रो के बाहर, but sitting full था. Sitting
Now, after 212 days, the financial capital Mumbai has now reported more than 1,000 new COVID-19 cases. The Omicron count is at 167 in Maharashtra, with 72 people beating the infection. City has reported 1,377 new cases and one death on Tuesday, a 70% jump in its tally on Monday. With this surge now, active cases in the city have soared past 7,000. Maharashtra's tally also saw an uptick owing to surge in Mumbai. The state reported 2,172 new cases. Maharashtra now has over 14,000 active COVID cases.
मुंबई का पॉजिटिविटी रेट अभी 4% हो गया है, तो 5% तक अगर पॉजिटिविटी रेट जाता है तो हम जब सेकेंड वेव में थे तब ऐसा ही कुछ 7-8-10% का पॉजिटिविटी रेट था, लेकिन 5 के आगे का पॉजिटिविटी रेट निश्चित तौर पर बहुत ही अलार्मिंग होता है। तो हमें रेस्ट्रिक्शंस के बारे में भी गंभीरता से सोचना पड़ेगा। वैक्सीनेशन ड्राइव और अच्छी तरह से किस तरह से हम कर सकते हैं, और रहा सवाल कोविड अप्रोप्रिएट बिहेवियर को भी और स्ट्रिक्टर मोड पे हम किस तरह से ला सकते हैं, यह हम विषय।
Now, there's another scare that's gripped Bollywood as number of celebrities have tested positive. Actor Arjun Kapoor, along with his sister Anshula Kapoor, have tested positive for COVID. Both of them are currently home quarantined. His girlfriend Malaika Arora will also be testing herself soon. Sonam Kapoor's sister Riya Kapoor has also tested positive, along with her husband Karan Bulani. The focus will now be on contact tracing to find all those who come into touch with the celebrities. It's not clear if they have been infected by the Omicron variant, though. This is the second time that Arjun has tested positive for COVID. In a matter of weeks, a number of Bollywood celebrities have tested positive. Earlier this month, the likes of actors Kareena Kapoor Khan, Amrita Arora, Seema Khan, designer Mahib Kapoor have tested positive. Mahib's daughter Shania Kapoor has a positive COVID result that's just been out. Now, Omicron cases continue to rise in India. The tally now stands at 781. Maharashtra now has 167 cases and West Bengal has reported 11 cases. 45 cases reported in Tamil Nadu, 4 in Chandigarh. Let's take a look at our ground report.
COVID-19 cases are on the rise in West Bengal, and as of December 28th, the number of COVID-19 cases stands at 752, while a day earlier than that, it was at close to 430 cases. Despite the fact that the cases are rising, the West Bengal government has chosen to lift the night curfew that was there in terms of the restrictions, but it could be that after the 1st of Jan, the restrictions would again be in place, considering the fact that the cases are on the rise. The restrictions were lifted keeping in mind the Christmas and New Year season, but because cases are rising, the West Bengal government is keeping an eye on the situation across the state. With camera person Kiranjit Das, Prema Rajam in Kolkata for India Today.
COVID-19 cases in the state of Tamil Nadu are seeing a rise. On December 28, 619 COVID-19 cases were reported, and 11 new cases of Omicron were also confirmed. Now the state tally as far as Omicron is concerned is around 45, of which 2 cases have been cross-verified to Puducherry and Kerala. With New Year around the corner, we're seeing that new restrictions have been put into place by the Chennai police. We're being told that in the beach there will not be any kind of New Year celebration that will be allowed. We're being told that on the day of New Year and the New Year Eve, a lot of restrictions will be put into place. No public gathering will be allowed. Even residential associations have been instructed not to have any kind of gathering in their apartments or societies. We're already seeing at the Besinagar beach, where we're currently at, barricades have been brought in here. Even here, people will not be allowed to celebrate New Year from 9 p.m. onwards. With COVID-19 numbers increasing, these are the measures that people should be using and ensuring they follow to prevent the spread of the pandemic. With camera person Daniel from Chennai, this is Akshana for India Today.
Now, amid the rising Omicron numbers, Hyderabad has forgotten, it seems, to enforce COVID restrictions. Telangana government has now actually extended liquor shop timings for New Year's Eve. While other states are imposing night curfew and sweeping curbs, Telangana government on Tuesday has granted permission to sell and serve liquor by bars, at events, at in-house events as well, are all allowed on New Year's until 1 a.m. Retail shops selling liquor to stay open till 12 a.m. The government has, however, asked people to follow the standard operating protocols.
We are surprised and shocked for the decision taken by the Telangana government to function all restaurants, bars, pubs as usual on the day of New Year celebrations. We demand Telangana government to withdraw the decisions and impose restrictions on New Year celebrations. How a democratically elected government can think of its revenue at the cost of its own public.
On Tuesday, Telangana reported 228 COVID-19 cases, while 62 Omicron cases also reported in the state. But amid all this thing, one particular decision of Telangana government has attracted a lot of criticism from opposition party. The government of Telangana has decided to allow pubs, bar, restaurant and events to remain operational till 1 a.m. on 31st night, while liquor outlets will also have extended hour and they'll close only after midnight. This decision has attracted criticism from Congress as well as BJP. Opposition parties are asking when neighboring states like Maharashtra and Karnataka, they have announced several curbs on New Year's celebration where large-scale gathering is expected. Why Telangana government is not considering any kind of curb? And that too, when state, in particular Hyderabad, is reporting Omicron cases. With camera person Damodar, Ashish in Hyderabad for India Today.
Now, with less than a week to go before the vaccination drive opens up for 15 to 18-year-olds in India, preparations are currently on in full swing across states. From Maharashtra to Tamil Nadu to the national capital, here's how states are currently gearing up to administer doses for teens.
India is gearing up to vaccinate its teenagers. The vaccination drive for 15 to 18 years old will start on 3rd January. They can only be administered the Covaxin shot. The beneficiaries will have to book their slot on CoWIN website. With less than 1 week to go, all states in India are preparing to vaccinate its young population, especially in view of the anticipated surge in Omicron infections. In Delhi, the eligible children will be vaccinated at the existing centres. They will be administered jabs at government schools and government and private hospitals. In Maharashtra, the number of eligible teenagers for the vaccine is being ascertained. 3.7% of the state's population is likely to be vaccinated. The state of Tamil Nadu is also gearing up to inoculate 33.2 lakh children. Assam's state departments and district administration are planning to administer vaccines to 18.25 lakh teenagers. And in Haryana, nearly 16 lakh eligible children will receive their first jab. The state government is collecting data on all school-going children. Children who were vaccinated in the trial phase have received their vaccine certificates.
जो पहला डोज लिया तब मुझे थोड़ा सा तो डर लग रहा था कि वैक्सीन लेने के बाद क्या होगा, क्योंकि ट्रायल में ले रहे थे, बट वैक्सीन लेने के बाद कुछ प्रॉब्लम्स नहीं आए हमें और कुछ भी जो हमें था वो कुछ हुआ नहीं हमें।
ये घोषणा जो प्रधानमंत्री जी ने की है वो उसके बैकड्रॉप में मैं उन सभी लोगों को कांग्रेचुलेट करना चाहूँगा जो बच्चों ने और उनके पेरेंट्स ने ये वैक्सीन की ट्रायल लेने की हिम्मत की और आज उनकी हिम्मत की भरोसे ही ये ट्रायल सक्सेसफुल होने के बाद बाकी सभी बच्चों के लिए ये वैक्सीन ओपन की जा रही है।
With Omicron cases on the rise, India is leaving nothing to chance by opening up vaccination to the younger population. Bureau Report, India Today.
Now, doctors have really wondered at the reasons behind long COVID and why it really affects several organs in a human body. A breakthrough study that was done on the COVID dead in the United States tells us that COVID stays in the human body much longer, in fact, months after recovery. Here's our detailed report.
2 years into the pandemic and countless cases of people suffering from long COVID. Some had difficulties in getting back to a normal life months after recovery. Scientists today have found some answers behind the extended illness. Scientists at the US National Institute of Health said they found that the virus is capable of replicating in human cells well beyond the respiratory tract in the human body. Because SARS-CoV-2 spreads within days from the airways to the heart, brain and almost every organ in the body, where it may stay for months. Studies say the delayed viral clearance is what leads to persistent symptoms of long COVID. Scientists have detected persistent SARS-CoV-2 RNA in the brain for 230 days. Infection of the lungs could lead to virus spreading in the bloodstream or viremia in mild cases. Results were based on samples taken from autopsies of 44 COVID dead patients. Indian medical experts have called the study a breakthrough in understanding long COVID.
It means it is not only limited to respiratory tract, the lungs, it could go into any part of the body, which includes heart, brain, etc. And all these long COVID symptoms like neuropsychiatric manifestations, seizures, brain fog, etc., they can all be found.
We have seen that even after recovery from COVID, the patients continue to have different symptoms. They were never fully comfortable, they continue to have symptoms. So there was always a concern that probably COVID virus has caused permanent damage to the organs, or it is due to the persistence of the organs.
Less viral clearance outside the lungs is related to weak immune response in the body in early stages.
ऑटोप्सी स्टडीज़ में ये पाया गया कि कई बार ये इन्फेक्शन करीब मोर देन 290 डेज तक वायरस, एक्टिव वायरस या रेप्लिकेटिंग वायरस बॉडी के अंदर था. तो ये दर्शाता है कि इन्फेक्शन इमीडिएटली आप दवाई दें और तुरंत से ठीक हो जाए, ऐसा नहीं है, ये मिथ है. तो इसलिए, और ये नहीं है कि हर केस के अंदर ये वायरल इन्फेक्शन जो है ये इतना लंबा चलेगा.
The results of the study, published in the science journal Nature, is yet to be peer-reviewed. But doctors are beginning to understand that COVID is multifaceted, systematic disorder.
Emerging scientific data now shows that reasons for brain fogging as well as neuropsychological manifestations of COVID have led to people suffering from long COVID for several months. As more such studies emerge, it will be known soon that influenza is not what COVID is all about, and it is ultimately a multi-systemic disorder infecting the whole human body. With Pawan Kumar, Milan Sharma for India Today.